Anti-epileptic drugs. A seizure is a brief episode of abnormal electrical activity in the nerve cells of the brain. So seizures take place in the brain, whereas convulsions are involuntary spasmodic contractions of any or all of the voluntary muscles throughout the body, including the skeletal and facial muscles. So the convulsion occurs in the body. Epilepsy is chronic, recurrent pattern of seizures. About more than 50% of the cases of epilepsy are primary. Another word for that is idiopathic, and it means we don't know why. We don't know why the person has this disease. The rest of them, of people with epilepsy, have what's called secondary, and we can identify a cause. Quite often it is trauma, maybe a cerebrovascular accident or some kind of disorder, or an infection. Now there's a classification of epilepsy: partial seizures, generalized seizures, unclassified, and status epilepticus. I'm going to refer you to box 13.1 in your book to get started, and then to the definitions in your book. Look them up, see what all these different things are, see if you can describe them. Anti-epileptic drugs are also known as anticonvulsants, and the goal is to prevent seizures or to control them while maintaining a reasonable quality of life. We don't want them to be seizure-free, but to have so many adverse effects that they have a terrible quality of life. So it's a balancing act here. And anti-epileptic drug therapy is usually lifelong. And a combination of drugs may be used, but isn't always needed. We start with just one drug, and then we may add a second, or maybe even a third, if the single drug alone doesn't do it. And for these medications, we have to be following serum drug concentrations. See what are the levels of the drugs in the blood. How high do we have to get the levels in the blood to control the seizure activities? So for the two drugs I've asked you to know, please do know what is the goal. What are we aiming for serum levels on those two drugs? Anti-epileptic drug therapy must prevent generation and spread of excess electrical activity, and also protect the surrounding cells. What are we trying to do with these drugs? We're trying to prevent or control seizures, and it is often a long-term maintenance therapy, and we use them for acute treatment of convulsions and status epilepticus. The drugs have lots of adverse effects, and they vary per drug, so please know them for the two drugs that I've assigned you. And these two drugs are Tegretol and Dilantin. Okay, nursing implications, assessment. We're doing all the basic things we've done with everything else. We are looking at liver functions and CBCs with these folks, as well as serum levels of their drugs and baseline vital signs. Oral drugs, people need to take them regularly, the same time every day. We're trying to get them to have a stable blood level of these drugs, which means you got to take them at the same time every day, and they need to take them with meals to reduce the GI upset. We tell folks don't crush them, don't chew them, don't open the extended release forms. If a patient is NPO for a procedure, you need to talk to the physician ahead of time about this. We don't want somebody having a seizure in the middle of an operation. IV forms are usually given slowly, but again, you got to look it up before you start running these things. Make sure you know what you're running and you're doing it appropriately. Maintaining the IV site, keeping it from leaking into the tissues, watching their vital signs, and phenytoin, usually it's normal saline that we're running with it. The patients should be journaling, keeping track of what are they taking for their drugs, when do they have seizures, what was happening at the time, were they sick with something else at the time, describing what type of seizure it was, what was the environment like. They can get a medic alert tag and wear it, and they should keep taking those drugs. Again, they're probably going to take them forever. Driving, they have to maintain usually a couple years seizure-free before they're allowed to have a driver's license. And while they're on these drugs, we need to be helping them to make a decision. Are these drugs impairing you enough that you shouldn't be driving at all? Or have we been able to find that level where you can drive safely and remain seizure-free? Again, lifelong maintenance with these drugs. As of now, these drugs are not a cure. They just keep things under control. We are monitoring for therapeutic effects, and we are monitoring for adverse effects as well.